Aphorism 210 or psoric origin are almost all those diseases that I have above termed one-sided, which appear to be more difficult to cure in consequences of this one-sidedness. All their other morbid symptoms disappearing as it were before the single great prominent symptom of this character are what are termed mental diseases. They do not, however, constitute a class of disease sharply separated from all others, since in all other so called corporeal diseases, the condition of the disposition and mind is always altered, and in all cases of disease, we are called on to cure the state of the patient's disposition is to be particularly noted. Along with the totality of the symptoms, if we would trace the accurate picture of the disease in order to be able, therefore, to treat it homeopathically with success. Explanation. In this aphorism, Dr. Heyman has given idea about causes of one-sided diseases, mental diseases. All those one-sided disease which are of psoric origin, which appear to be more difficult to cure because of its one-sidedness, all other morbid symptoms disappearing as they were present before its single great prominent symptom. The diseases of this character are termed as mental diseases. Mental diseases do not constitute a class of disease in which the disposition and mind of the patient are always altered. In all diseases to be cured, the state of the patient's disposition is to be particularly noted along with the totality of the symptoms, and if we would trace an accurate picture of the disease, then only we can get success by treating homeopathically. Footnote 1 to 1. How often, for instance, do we not meet with a mild, soft disposition in patients who have for years been afflicted with the most painful diseases, so that the physician feels constrained to esteem and compassionate the sufferer? But if he subdue the disease and restore the patient to health, as is frequently done in homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. He often witnessed the occurrence of ingratitude, cruelty, refined malice, and propensities most disgraceful and degrading to humanity, which were precisely the qualities possessed by the patient before he grew ill. Those who were patient when well often become obstinate, violent, hasty, or even intolerant and capricious, or impatient, or desponding when ill. Those formerly chaste and modest often become lascivious and shameless. A clear headed person not infrequently becomes obtuse of intellect, while one ordinarily weak minded becomes more prudent and thoughtful, and a man slow to make up his mind sometimes acquires great presence of mind and quickness of resolve, etc. Explanation of footnote 1 to 1. We don't meet the person with a mild soft disposition who has suffered from most painful diseases. Patients cannot be calm and mild in nature who is suffering from pain since long. So, here the physician has a very limited scope and restrictions to admire and to compassionate the sufferer or patient, because here the disposition of patient is changed. But if we subdue milder the disease and restore the patient to health, as it happens by homeopathic treatment only, it is surprising to see the frightful alteration in the disposition, and sometimes it is horrible also. The physician himself becomes witness of the occurrence of ingratitude, cruelty, refined malice, and propensities most disagreeable, disgraceful, and degrading humanity. These are the qualities possessed by the patient before he grew ill. So, the patient who is basically of mild nature can become obstinate, violent, hasty, or even intolerant and capricious or impatient or low spirited when ill. Those who are abstaining from all sexual activities can frequently become lascivious and shameless. Clear headed patient or intellectual person can become dull intellectually, while one ordinarily weak minded person can become more thoughtful. Who are very slow to take decisions mentally can become active mentally and acquires a great presence of mind and quickness of resolve, etc.